Presentation title shown: Building Bridges to Improve Mental Health.
Good afternoon, and thank you for being here today. Hope you are enjoying the Child Welfare Virtual Expo up to this point. We appreciate you joining us today for our workshop around cross-systems collaboration. In this 90-minute session today, you will hear from 7 of us. Mary Wachanski is the National Center Director from CASE. Debbie Riley is the CEO at CASE. Erin Bader is the Director of Knowledge and Dissemination, also at CASE. I'm Michelle Seymour, the National Director of Equity and Partnership for the National Adoption Association. To reflect our commitment to collaboration, we invited some of our partners to be here with us today from Oklahoma. Bonnie Goodwin is the statewide coordinator of Adoption Preservation Services. David Johnson is the Human Services Program Administrator, and Executive Director of the Foster Care Association of Oklahoma is Sarah Herron. Today, we want you to walk away with a clear understanding of how the National Center can help you build bridges between systems of care. No need to take notes today. We will make sure that the slides are available to you to reference later. We will cover the goals, objectives, and strategies for the National Center for Adoption Competent Mental Health Services, why cross-systems collaboration is key to transforming systems and services, identify steps to improve collaboration skills, and provide information and resources for continued learning. We invite you to use the chat throughout the presentation for questions or comments. You will also be provided with our contact information for any questions you may have in the future. We want you to have immediate access to our experts in the form of resources and materials in the Knowledge Hub and from our team comprised of many organizations with unique experiences and expertises. Next, you will hear from Debbie Riley on why the National Center.
Good afternoon, and thank you, Michelle. Our team is very excited to be here as we are part of this important convening, and I'm going to talk a little bit about why the National Center. And as you're listening to us throughout the presentation, I hope that you'll think about the role that you have in leading from where you are. No matter what your role is in the systems that you're working within. So at our center, we really think about what is the why, and I think you probably are joining us in collaboration of why we're doing this, is that, we envision that all children and all families who interface at some level with the child welfare system have the tools to reach their greatest potential. And really how we're going to meet these goals and objectives of the center that you'll hear more about is really to align many of you as change makers in the different child serving systems in hopes that we can build strong, vibrant, honest collaborations where we can advance and sustain the workforce development that we're going to be doing around adoption competency. And I know that we're using the word adoption competency. Our work is broad. It embraces all children, again, not just those who have joined families through adoption, but we're really looking at building the competencies of a specialized workforce. And we are very committed to partnering to build culturally and linguistically accessible mental health services that are uniquely designed to the populations of children in the system, but also uniquely designed to your own child welfare and behavioral health systems. Next slide. So I wanted to ground us a little bit in the need. I'm sure that you are aware of this, but if not, I wanted to talk more about the fact that this is a population that overutilizes mental health services. And often we see that children in care are 3 to 4 times more likely to be diagnosed with a mental health disorder. As you can see on the screen, the diagnosis range from attentional issues to post-traumatic stress to children with mood disorders, anxiety. Again, prominent mental health diagnosis for children that have experienced a child welfare system in some ways. And what's really concerning is, and it's still rising, the overutilization of psychotropic medications for children in care. And I think post-COVID, we're seeing more of this as we have a workforce development issue and the mental health crisis. They're all convening to um, continue this utilization, which our belief is that if we could provide the right kinds of services earlier on, that we would not have to go sometimes to this extreme. And then when we're looking at disproportionality, we know that 1 in 9 Black children and 1 in 7 Native American children spend a part of their childhood in foster care. And what's really concerning to me as a mental health provider myself is that when we're not actively engaging those with lived experience in guiding the treatment, and when we're not aligning the right kinds of treatment and the competencies of the providers, we tend to see young adults and adults continue to struggle with lifelong mental health challenges. Next. So I wanted to build upon some lessons learned. We were excited back in 2014 to be awarded another collaborative agreement with the Children's Bureau, the National Training Initiative, which many of you are familiar with. And from that initiative, we've learned an awful lot that is going to roll into the direction of the new center. In the new center, we still will be infusing this adoption competency, evidence-informed training curriculum into mental health. We're excited that you have supported us in the infusion of NTI and child welfare systems. In fact, 33 child welfare systems currently are using the training in some capacity. But what we learned from NTI that it was a much deeper lift and challenge to engage mental health providers and systems of mental health in the utilization of the training. So we are very much making this at the forefront of the new center. And what we also learned, given that we have a ever-changing mental health workforce, that we are having, I think, less experienced clinicians come into the work, and they are requiring a larger support system of coaching and learning collaboratives. And we know that to build their success, that we have to keep supports underneath them. And so that's something that we'll be doing very intently in the new center, and you'll hear more from Mary in a few minutes in talking about that. So I hope this gives you a little bit of an overview of how we came here and the fact that this is a very unique initiative, again, funded by the Children's Bureau for the next 5 years. And for the first time, really bringing child welfare and behavioral health to the table, as well as other systems that our youth and families engage in. So I'm going to turn it over to Mary now.
Okay, thanks, Debbie. As Debbie mentioned, our primary focus, we are often working across systems to enhance mental health outcomes for youth and their families who are have experienced child welfare. And I started with that because all of our efforts are going to drive that outcome. But we're starting at a place of collaboration, and the National Center was actually built with that in mind. We know that the challenges that we have in our systems to improve mental health services, to create access for services. We know that in order to solve those problems that are very complex, we need the voices of many different players. And so we're bringing together folks from mental health, from child welfare. Lived experience is crucial to the work that we're doing from the very beginning to the end. We're also bringing together folks who advocate in policy and also insurance. So we're really bringing all the players together that can help in this collaboration to move forward the child welfare outcomes that we're trying to address. And so when we look at how our professionals, as Debbie mentioned, our professionals right now are doing the best that they can. And I think anyone who is a mental health professional knows that we just have a large acuity, large caseloads, just like they do in child welfare as well. but we need to do better around training our providers to work with this population. It's a subspecialty to be able to have the skills and the knowledge as well as the practice reinforcement to change how clinicians practice so that they can be more effective in the services that they deliver for families. And so the increased use of training is really critical to our work. Equally as important is access to those services. So we've been talking to folks around the nation, and we know that access right now is a challenge. And so we are driving responses to that so that we can make sure that all families have access to competent mental health providers. And so we're looking at things like how to utilize telehealth, how to look at insurance carriers for cost of services, and all kinds of things that will improve access to services. Our efforts also are always looking at sustainability. We, as the National Center, will be working with states, tribes, or territories. We'll be working with 6 each year. And our work with each state starts with sustainability. How can we actually ingrain and embed long-term sustainability of adoption competent responsive services? And so we start with that premise of what do we need to do differently? Because a training alone won't get us there. And so we know that we have to also bookend the constant support of families and collaborations to advance the system so that we can get the improved outcomes that we're driving. And so our center was intentionally created with a real value on collaboration. And so I know this webinar itself is designed to showcase how collaborative we actually are. And we're doing that because we do believe that bringing diverse points of view, different perspectives to the table who have different needs eventually is going to create the best solutions and the most sustainable solutions. So here at the National Center, we have deep expertise in adoption competency. And as Debbie mentioned, that word, we want to just kind of elongate what does that mean to our audience. And that means any child or family who has experienced a child welfare system, no matter where they are on the continuum. Those families deserve and need mental health services that are designed with them in mind to provide the right support at the right time. So CASE is bringing that expertise. We're also bringing expertise from the Baker Center on infusing practice changes in mental health provision. We have experts in policy and youth engagement. We also have a focus on racial equity and cultural responsiveness, as well as having youth in the room. Again, these services, and it's really critical to our work that we make these equitable, accessible, and that we have a focus on who is it least accessible for and make changes in the way that we provide services. And so again, this is kind of our framework is that many minds will provide better outcomes and solutions, and those will be sustained. So again, the strong collaboration in terms of our experts who bring technical assistance to sites. So I want to share that with you. Okay, and I will move it over to Michelle.
Thank you. The National Center has paid special attention to applying a racial and broader equity lens to the work we're doing. We strive to have an accessible and an inclusive knowledge hub, ensuring that topics reflect the needs of underserved communities, highlighting material from underserved community members, and being transparent about the process used to choose material for the Knowledge Hub. We are doing direct outreach to community-based agencies and membership organizations that are trusted by traditionally underserved population and seeking partnerships. We are working to build rapport and increase brand recognition to increase accessibility to those in most need of support. We are also working diligently to engage communities to provide on-site to inform our on-site technical assistance. To do this, we are using a comprehensive assessment to determine readiness and willingness to address systemic barriers. We will use affinity and focus groups to create safe environments to gather information about anti-oppression and anti-racism work that has been done and still needs to be done. Next, you'll hear from Erin.
I'm gonna talk briefly about our universal technical assistance and try to advance my slide at the same time. One sec. Okay, so the universal technical assistance is the information, resources, and assistance that we can provide a wider audience. Our intensive technical assistance that Mary will talk about is more focused. And the majority of the information and training and resources will come through our National Center website. And you can see a photo of it here, and some key features outlined. I would encourage you to visit our website to learn more about both universal and intensive technical assistance, and search our Knowledge Hub, which is a dynamic, ever-growing hub of resources and information organized by topics related to child welfare and mental health. We also have a blog, and please do sign up for our email list, which is the best way to stay connected and to be aware of when we release new materials and information. I wanted to highlight this graphic as well, because while it's important and it's our job to disseminate information, we also want to take the stance of learning and listening from you all, and from those that are doing the work on a day-to-day basis. We are going to always be seeking input and information from our TA sites that we're working with, from focus groups, attending conferences, and also surveys and kind of feedback through our website, and giving people an opportunity to kind of share information, best practices, so that we can then amplify that out to our larger audience.
Okay, thanks, Erin. And so we're going to go through this a little bit quickly, but I want to invite anyone who would like to be in a larger conversation with us about our intensive technical assistance to please reach out after the webinar. But basically, we are working with 6 states, tribes, or territories to actually engage in a change management process with them. We want to build more responsive, adoption competent systems and services. And so we are working with each location, jurisdiction, to come up with a technical assistance plan that is designed to meet their needs and their priorities. Our technical assistance is really a process of aligning the work that's already being done and the goals that are already being driven in states, but we come in as some extra hands and some extra support to build that system of care that we're looking for. So our technical assistance process is very similar. If you've engaged in technical assistance, most of them are using a fairly similar framework. And I want to just start with our innovation. What are we actually trying to drive? We're trying to drive the knowledge base, the skill base, and the practice of mental health clinicians so that they can adequately serve and respond to families and youth who've been impacted by child welfare. And that is not an easy thing to do. This is a subspecialty, and it requires not only training, but also ongoing supervision and ongoing coaching so that this type of service delivery is maintained to fidelity and actually works with our families. Our process goes through a number of stages. We work with jurisdictions for 12 to 18 months. And that process, when it's over, when we've accomplished our goals, as Erin was saying, we have a knowledge hub, and we don't believe that when the technical assistance is done, that there are no more available resources. We connect you with the knowledge hub ongoing throughout our process. And in that knowledge hub, you'll have connections to other jurisdictions who are doing similar work or others who want to do similar work for collaboration and ongoing support. And then we'll look at each jurisdiction for the local drivers. What levers can we pull to make this work a reality? And we build these incredible teams. And these teams look different in different jurisdictions, but we know that it takes a lot of organizations and a lot of individuals who are aligned in the vision that we have to join us in this work so that it can become a reality. And all the while, we're doing improvement cycles to look at measuring progress towards goals, and making sure that we're achieving what it is that each state wants to accomplish. Okay, next slide. And so now we're going to move into collaboration, which is really, I think, fundamental to our work and to your work. And I think all of us who are working in this space understand and appreciate the time that it takes and the dedication that it takes to have a mindset that knowing that many minds are better than one, and that a collective response is this response that will be sustained. And so when we think about our work, as I said, we have designed our experts that we're drawing from in the country as a collaboration because they have unique perspectives and they have unique expertise levels. And when we work in jurisdictions, we bring together all of that collaboration at the local level. And so, as we mentioned earlier, we are working cross systems as a primary goal to build these relationships and the ability to collaborate with each other. Okay, so next slide. When we think about collaboration, and we've probably all been involved in various types of collaboration, the what you're doing and the why you're doing it, it may vary, and the focus varies, and but what's really stays the same is how these collaborations become effective. And there's 5 critical ingredients, and probably all of you can relate to which of those ingredients work well in existing collaborations and what might need support. But we know that if we follow the 5 C's, which we intend to do in all of our collaborations, we will be on the right track. And the very first thing is clarifying the purpose of why the collaboration exists and convening the right people. And we know oftentimes we start with a smaller group of people, and that group grows to be inclusive of every right person who wants to join in the journey of transforming a system. We also know that cultivating trust across systems, with families, with policymakers, with everyone in the system is a major part of our work. And we do know that that takes time and that takes energy. But the relationships that we build and the alignment that we create early on in our initiative serves us very well. We will look at existing activities that are happening in states so that we are aligning and not duplicating. We're looking to remove redundancy in systems. And then we're collaborating again for systems impact. And again, we're trying to look at, our vision is the same, whether you're working in behavioral health at a public agency, a private agency, or you're working in child welfare. Everyone is in agreement that we need to create responsive systems that are available to all, that get the outcomes that families need and deserve.
There are benefits and challenges to collaboration, as we all know. Benefits can include an understanding of the child welfare system, which we all know is incredibly complicated, the ability to comprehend and make recommendations for co-occurring conditions and situations, the ability to focus on individualized care and the unique needs of one child or an individual child, more accurate tracking and outcome data, quicker and more efficient processes across multiple systems, and more positive outcomes for children and families. Some of the difficulties can be present in developing trust due to negative ideas around the child welfare system, ineffective communication like differences in jargon or acronyms across fields, the time commitment needed to establish and nurture and sustain these relationships are often difficult for systems. And finally, competing funding interest. It's often difficult to figure out where to put the funding, and everybody needs it, right? Next slide. Okay, so let's see. As we collaborate with youth and families, we need to take some things into consideration, making sure that we are being trauma informed. We're coming into this and asking people to give us their experience, to talk about what they have been through, where they've been, and how they've experienced the system. So we want to ensure that parents and youth feel comfortable sharing their expertise, that they are feeling like their input is needed, necessary, and used. In order to really nurture this collaboration, we want to make sure that we're following confidentiality, that we're talking to people about where information will be shared, who it will be shared with, and what identifying information will be out there. We're really looking at making sure that this collaboration is trauma informed, right? We want to make sure that we are aware of triggers, that we are making sure that participants have what they need while they're there. If a participant has trouble managing emotions or seems to be struggling with anything during the meeting, that we have private check-ins and that we're taking time to be intentional about our use of the community and how we work with them. After each session, making sure that we have time for parents to talk, allow parents and youth to decline participating any further, making sure that everything is a choice. We want to make sure that we promote safety, that we promote these choices and control, not only in the environment, but what we use their information for. Make sure parents and youth have all the information they need for the meeting in advance so that they're prepared. This would include the agenda and any questions that we would be using, talking about, or discussing. Provide training on strategic sharing, making sure that a process is developed that is true to trauma informed, and that people with lived experience can tell their stories in short, effective ways that avoid re-traumatizing them. Having rules of engagement and making sure that everybody is aware of those. Being clear about how decisions are made, how disagreements should be expressed, and even suggestions about how much time each individual can take. But making sure that we have all of these things present and that everybody is aware so that families feel comfortable and that we can get the information that we need to move forward. Next would be Debbie.
Thanks, Michelle, for that wonderful overview. And I've been engaging in the chat. I'm just really enjoying and valuing the comments that you're all providing about, what does collaboration look like, and what are some of the key aspects and necessary ingredients. So I hope that you all look in the chat at the same time. We have a wonderful opportunity right now to hear from a panel from Oklahoma. Oklahoma has been a part of our collaboration since 2015, a long time, with the National Center NTI, and now moving into being our first site for the National Center for Adoption Competent Mental Health Services. And we just thought it would be really valuable to hear firsthand what their experience is around collaboration, cross systems collaboration, and particularly, hearing different voices, the lenses from others that are part of those collaborations. And again, as you're listening, thinking about your specific role and how you can be, I think, a key driver of effective collaboration. So I want to introduce to you first Dr. Bonnie Goodwin. Bonnie, you can say hey, and then David Johnson, and then Sarah Heron. So I'm going to ask them some questions, and you can have some opportunities too if you want to put something in the chat. But I guess the first thing that I would love for you to share with us is, when you think about collaboration, as we're asking those listening, what are some key words that describe the values of cross-system collaboration? So I'll start with Bonnie.
Hi, everyone. Thank you guys for letting us join you today in this great conversation. First and foremost, the word that comes to my mind, and I saw similar things being put in the chat from different people, is connection. Being connected purposefully. Another word is intentional. So the very doing it for a reason, having building relationships, but also reaching out with specific purposes, and for the goal of having a shared vision. So those would be my words.
Great, thank you. And David?
I think the first thing I would say is active listening. I think it's really easy to get caught up in all the things that you want to say and not hear what your collaborators are saying. And so that's really the key to me, is that active listening piece, as well as having very clearly identified goals for what you hope to accomplish.
Great. And then Sarah, and feel free as we're going along to sort of, share a little bit about your role. But Sarah, a lot has been in the chat about the engagement of those with lived experience and creating safe places. And I wonder if you can share a little bit about your role, and then the words that you would describe, cross-system collaboration.
Sure. So I run the Oklahoma Foster Care Association, and when I think about cross collaboration, I think a lot about a humility and a compromise that you really have to come to the table with. We were a part of passing some really big legislation, and we came in with some really big goals, but we had to do a lot of compromising along the way in order to get something accomplished. And I think it's just really important to remember that sometimes baby steps are just as important as, like, crossing the finish line, because we'll all get there. But sometimes it just takes a little bit of time. And when you're with that lived experience piece, it can create a lot of angst sometimes, because you're like, this is broken, let's fix it now. But sometimes it just takes a little time to get there. And so I think compromise, humility, and then the last word I just think is action, because at the end of the day, we still want to see movement. But my partners here, they shared some great words as well. And I think it just kind of takes all of that.
So obviously part of what we want to impart today are strategies, tools that people can take home with them. So can you share a little bit of some of your insights on how you would leverage systems and structures to accomplish the goals of a cross collaboration? I'll let Bonnie start.
I think really being able to know what their role is. Knowing, like I've heard, Sarah, I'm totally going to steal something from you. So this is Sarah's thought, but I love the concept of, she shared with me a while ago, a 6-lane highway, that the cross systems collaboration is like 6-lane highway where everybody stays in their lane and knows what they're doing, understands each other's roles, but also is very clear of how can we move lanes, how can we work together, and we're all going the same direction. So I think being able to understand the structures and the other systems, I saw lots in the chat about sharing the same language, understanding what we're saying to each other, and taking the time, if we have all those acronyms, taking the time to explain that and make that really clear and open to everybody at the table. And then understanding how those systems can connect and weave together.
Great. David, do you want to comment on that?
Sure. I think it's very important that the goal be beneficial to everyone collaborating and that they understand how it's beneficial. I think as an administrator, we often get things brought to us that we have to determine, is this going to be worth our investment of our team's time? And is it going to help us serve this population? And so I think avoiding ambiguity, being very clear about this is something that I think is mutually beneficial to us to partner on. That's what I think of in this area.
Can you share a little bit about some of the lessons that you've learned throughout the work?
Sure.
Still me? All right.
Sure. We'll start with you and then we'll go to Sarah. Yeah.
Okay. I think that engagement is improved when participants feel like their contribution is valued and so their voices are heard. I think that I've also kind of learned that not to make assumptions about why another maybe agency or partner does a thing a certain way until you've had a chance to really discuss that with them. Working in child welfare, you get a lot of assumptions about why decisions are made, but if you really get to the table and have an honest conversation about that, it's much more informative and effective.
Great. I'm going to move to you talking a little bit about the actual collaborations that we're speaking about today. Maybe you could share a little bit about the history and what makes it a success for those that are listening, particularly now when we're thinking about this center of trying to bring sometimes two systems that have not always been together. Can you talk a little bit about that? And I'll start with Bonnie.
Yeah. As you mentioned, Debbie, Oklahoma has been, we were part of the initial NTI pilot back in 2015, which seems like a very long time ago. But the cool thing is having the right ingredients at that time. And as time has gone on, I feel like the ingredients have just gotten better. Like the relationships, the connection between the systems. There've been multiple multiple things that have been going on. And as people work together, they build trust with each other. They have, coffee on the side and get to know each other a little bit better. And I think that environment of being able to know each other, be known, and then have your voice be, it translates into this sense of your voice is valued, and not only your voice, but then also those that you're connected to. So when you have some of that connection, then you're able to connect to other people that you know, and their voice is trusted. So it really becomes an exponential growth over time. And so being able to step into this next space of partnering with the National Center, and it just feels like the next step, like it's just what's supposed to happen, and really what's already been. It's like coming alongside with some wonderful partners who are continuing what's already happening here. The relationships, the collaborations, the hope, the shared vision. It's really, we all have been talking about for a long time. What is our goal in this? What's the purpose? Clarifying what does that mean for everybody? And then bringing in all of I think the cool thing of what we're getting to do now is bringing on in the voices of those that we are all connected to. So it's making it a bigger conversation. More people have ownership. There's a lot more perspectives that we're able to hear all at the same time because of what's happened in the past and how we're able to grow it now.
So I'll let you and Sarah comment, because you said that there was a resonating of your analogy about the 6-lane highway in the chat, and folks really wondering, well, how do you move along without crashing? And then maybe somebody said, well, maybe we need a driving manual, where we could create something, a resource of a body of communication, rules of engagement. So I'm curious about, Sarah, since Bonnie said that you started this analogy about the highway. If you could speak to that, how do you not crash, and what could we do? What kinds of tools could we create to foster engagement?
Well, Bonnie explained it much better than I shared it with her. So she gets a lot of credit there. I think really strong leadership. David talked a little bit about, being active listeners. And I think when you have really strong leadership, what the ultimate goal is. It's easy and fun to follow. And, without crashing, I think, I'm originally from California. So I think that's kind of where the visual came, the 405, heading in. I thought I saw a couple of California people here, being on the 405, and it is, you look at like, how is this just going, and nobody is, and it's just moving. And I think it's just because we really, when it's working, we have a clear understanding of what our role is and how to cross lanes, how to work with others, but not crash, not overstep, not overspeak, not do the work that somebody else is already doing or actively working on. When we were talking about that lived experience, I almost feel like the lived experience also needs to even be a little bit ahead, the loudest voice in the room. There's no one that's going to really be able to speak to the heart of these issues like somebody who is living and breathing it. And I think one thing though to remember is lived experience can last, generations. So I also think the lived experience in the room needs to be the active living. We've come a long way. It was somebody who was in foster care 10, 15, 20 years ago. It's not the same system. So I think the lived experience needs to be current. Somebody, who is experiencing today's policy, today's barriers, in order to really see how to move forward versus, kind of recalling what it was like for me to be a foster parent 8 years ago, because it was a very different system.
David,
Yep,
go ahead.
I just, with the whole, I don't want to overemphasize this analogy, but as you were talking about it, Sarah, it made me think about like the driving manual or something like that.
Mm-hmm.
And I think something that matters is that we might need to honk at each other. That sounds really cheesy, guys. But being able, that humility, that openness of being able to accept that sometimes there is going to be pushback. And I'm thinking of what you were saying, Sarah, of lived experience, that sometimes there is a moment where the person at the table has been leading this work for a while and they need to hear it's not helping, it's not working, you know. And what do we do when we're driving and you hear a honk? You kind of slow down and you try to see what's going on. And so I think that's a similar kind of idea of like not immediately getting angry or upset or really overly protective of what you've been working on, but also being able to slow down for a second, think about it, look around, listen even deeper, like to what's the heart behind what's being shared here, and then remembering that we're all going the same direction. We all want the same goal, and we don't want to crash.
You know, the metaphor is continuing in the chat, so I'll keep going with this. And
Is it?
everybody's loving this. But one of the comments was, well, we have to keep the car fueled and we need to stop and sort of acknowledge the accomplishments. And I'm wondering, are there strategies that you've all utilized to how do we stop and at least acknowledge that we made it through 9 miles without crashing?
I think with large systems moving together and any kind of change in a big way, it is slow, like what Sarah said, and it takes intentional, purposeful celebration where we do look at, hey, look at what we did, even if it's a baby step, and we do celebrate it, and we recognize everybody's strength and the ownership piece that they had, the voice that they shared, and being able to get to that next step. So really being mindful of what are we doing? How have we moved the needle, even if it feels small and slow.
Mhm.
I think what Bonnie said about, relationships earlier too, that's really hard to do over Zoom. So if you can do these meetings in person, it's a lot easier to honk, as she was saying. It's a lot easier to say, hey, you know what? Man, I'm in the trenches right now, and that doesn't sound like that's going to be very helpful. You could say it a lot kinder than that, but that just, there's sometimes people, they just don't know. They have the best intentions, and I think going into those meetings and those environments, knowing that everybody has the same mission. But I loved what you said about sometimes we do have to kind of nudge and to say, hey, you know what, like, how about this? Or, I tried that, here were some issues with that. And, but that's done best, I think, is kind of my point, in person. When they can see your facial expressions, they know that it's not coming from a place of criticism, but just really just trying to just keep moving together.
So we're almost at the end of our time before we move into small groups. Any sort of last words, anything that you want, little golden nuggets that you want to further share with those listening today?
Well, I've yet to add to the car metaphor, so I feel like I need to do that. But all kidding aside, I have heard a similar one about, which I was going to mention earlier. It's important to look back to see what's been done prior, so you don't repeat mistakes. So, like looking in the rearview mirror, you can spend a moment doing that. But if you're focused on the past, you're going to hit whatever's in front of you. So, I do think it's critical that you look back to what's already been done and whatever you're working on to see what's been effective, but also to stay focused on the goal ahead. So
Yeah.
And advice for, again, thinking about the theme of the conference, leading from where you are. We know we've had a lot of turnover. There are lots of folks listening today that might be in different new roles. The thought of cross-system collaboration could feel very intimidating and overwhelming. Any words for those that are new to all of this?
I think what really ownership really matters of a culture of that this is what we are doing. Sarah mentioned, and I totally agree, that leadership matters. Having leadership that establish this value, and this is the way that we do things, is being humble and listening to each other. But then, you know, even if you have great leaders at the table, or of the systems who are working together, it matters everyone else in the system. So the everyone has to come alongside, join that culture, be a part of that culture of speaking clearly, being open, being humble, but then also listening really well. And so everyone, everyone has a big role to play in the whole process of moving large ships in different directions. Everyone matters.
Can
Sarah?
I just say something real quick, 30 seconds or so?
Yeah.
That is so important. Come ready to work and not like point. David mentioned this yesterday, and I thought this is something worth mentioning. You know, really come prepared to be a strong worker, be a strong, you know, somebody that they can really lean on. You know, I come from the foster care community, so you know, there's lots of opinions as a foster parent. You see that, you see it all. You're really in the middle of all of these moving parts. And so you see issues, and the most valuable foster parent is somebody who comes up with a solution behind that. So it's, instead of just, you know, complaining about it, or, you know, it's thinking it's someone else's job. It's just, it's very helpful to have everybody in the room willing to do the hard work.
Great. Well, I hate to end this part, but we need to move on. So thank you so much for taking the time and sharing your professional and personal insights. And again, thank you to all of our participants who've been so active in the chat. And I'm going to turn it back to Anitza, who's going to talk about our small groups.
Yes, thank you so much. Hello, everybody. So we are going to be moving you into breakouts shortly.
The speaker is identified on screen as Anitza Guadarrama, Capacity Building Center for States. She, her.
And we encourage you to come on camera and come off mute during your breakout so that you can participate in conversation with your peers. We are going to be sending you to your groups automatically, so there's nothing that you need to do. And we will see you back here in 15 minutes. And my colleague Waleska will be opening the rooms shortly. We're going to stay in the main room just in case there are any issues. We'll be able to problem solve them for you here. Good luck and have a great conversation.
Welcome back, everyone. Thanks for coming back. We wanted to spend a little bit of time now to kind of share the wisdom from each of the breakout rooms, since we were only able to be in one. We can all benefit from hearing kind of the main takeaways. So let's start with group one. Who's going to report out? We have everybody back.
Julia, I think it's Julia.
Yeah, absolutely.
Thank you, Julia.
No problem. We talked a bit about what it means to invite people to the conversation, and what are some successes and challenges that people have found when engaging lived experience, and then also in a collaborative environment, and then how to, in some of the, lastly, we talked about strategies. How could we move something forward from here? And so under the successes, we had one peer specialist mention that inviting lived experience voices, and reframing the discussion such that it brings the lived experience voice into the work, shows that it's not just about making lived experience people show ponies, but rather important to the discussion in order to make actionable changes. And another success from Margaret was that that they pitched to the Youth Advisory Board, but in order to work with them, they met them where they were at. They found them and said, look, we can meet you outside of your usual work hours. We know everyone is busy. What works for you? Accommodate them outside the norms of those times. Some of the challenges faced were that, there's a challenge in making sure that when you bring in lived experience, that you're not just, calling it, not just, I don't know how you frame it, that not just tokenism, not exploiting or making lived experts, performative. You're making them part of the planning and help having them shape the story. And it's a challenge to, that nuance. Another challenge was that there's not enough education on the roles, like in a sim lab, for instance, to include the staff participating. And sometimes that can be confusing and takes away from the experience. And then another challenge was that communication is really important, and sometimes parents, families, they need some support in how to connect and bring their own voices to the table. Because, maybe they rely on their case manager who bring the voice, but then, with turnover and everything, case managers come and go or whatnot, there's a need to empower the parents and families. And then we also had another comment that, there can be a power differential when you're looking at families and people in places of authority. And there's a need to bring everybody to the same page to learn how they can make change and bring them into the loop and share and show, what this implementation or action plan might be so that people can see the changes. And then the last piece, as far as how people were suggesting to move forward, there can be just simple changes like respectful conversations among judges and parents, people of authority and parents and families that gives some hope rather than just a feeling of punishment and shame. And it doesn't have to be a huge gesture. Any action is important, any minute of time, and then also the people of authority being humble and accountable also helps move things forward. And that was what I had in my notes.
Great job, Julia. Thank you. There was so much good information there. How about group 2?
Okay, this is Mary, and I can give some takeaways from our group, and also Deanna, Bill, or David, anyone who wants to share, please jump in. One of the things that we spent time talking about again was revisiting, the 5 C's of collaboration. And we introduced the book, The 5 Dysfunctions of a Team, and looked at the inverted triangle of results to trust. And as we talked about how important trust is in equalizing, the room for people to fully participate. And so we talked a lot about what that looks like and how you do that. And so, it was put in the chat, the book, if anyone is interested, because it gives people exercises, whether it's a collaboration across a system or a team that you're working within your department. It's really good feedback on how you do cultivate trust and how you move to achieve results. But, typically we're focused on results, and this actually inverts it to say, start with relationships and people first. And then we talked a little bit about reciprocity, and that people who are in collaborations, they need to understand what is in it for them, so that there's mutual benefit. And so people are willing to give time, energy, thought, attention, but they have to understand how it will benefit the children and families they're serving as well, so that it's clear what the benefit is to them. I think we also talked a little bit around, this virtual world that we're in, and making time for developing human relationships, and knowing that collaborations work better when people actually have, they know something about the people who they're collaborating with. And while it's also a great advantage to have technology and use Zoom to have multiple voices, sometimes it can be better supported if there's some combination of in-person relationship building along with, the extension of virtual technology. And so, we went back, our tools were really re-examining the 5 C's for collaboration, looking at the 5 dysfunctions of a team as an inverted pyramid to accomplish that. And then, I don't know, David or Bill or Deanna, anyone else who want to chime in just for a moment.
I think you covered all the main points that I remember. I don't know if the others have any input though.
Sounds like a rich discussion and great ideas.
Yeah, and looking at the ability, the ability to influence results, no matter where you're sitting, based on the relationships that you're creating and the input that you're providing. And, again, thinking that you don't have to have an official space and title to have incredible contributions to a system change. So that's it for our team.
That's great. Okay, so I had group 3, and we were talking about what we can do now, like in the immediate future, to improve cross-system collaboration. And we had a great discussion as well, and just some key takeaways. Speaking the same language and identifying kind of the common goal, that everyone is clear on what we're working towards and how we're going to get there. And with that everyone has the same information, so it's equitable across the board, and they can participate in the discussion informed. The connection came up with us as well, like focusing on relationships and getting to know each other, and that relationships are really key in child welfare and like working across systems. Sharing of resources, using active listening, and then we talked about accessibility, both geographically, transportation accessibility. We had a member of our group that lives in Alaska, and obviously things are very spread out. And how do you get partners to the table when you do want to have those in-person convenings? Funding is an issue, but then accessibility as far as closed captioning and note taking, and just some more of those logistics when you're having meetings, so that everybody again has the equal footing. And then leaving meetings with actionable items, so that people are clear on what they want to do or what they need to do, and everyone feels like the meeting had a purpose and was efficient. And then the last one I had written down was intentional, being intentional. How about group 4?
All right. We talked about how cross-systems collaborations reduce barriers or reduce disparities at the front end. We had a really good conversation in there. My group really talked about being able to surround around the entire family. We talked a lot about being able to help consumers of services be able to understand the services, and that building a system where everybody knows what everybody else is doing will create better outcomes for families. We talked about creating like kinship teams, which I thought was absolutely amazing when we're talking about providers knowing who's working with the children, who's working with the parents, is everybody involved, having meetings where everybody is together and being able to all hear the same thing at the same time. We also talked quite a bit about removing the term case from our work and moving more into humanizing the work and being called service facilitators or care coordinators or family navigators, something that says more about who we're working with versus what we're doing, which I thought was absolutely amazing. We talked about being able to help to move each other's disciplines further, being able to push back on language. Language means a lot. So really being able to do that, and how cross-systems collaboration will help to keep families together, which I thought was absolutely great, as we talked about being in a space where everybody's voice can be heard and that there's value to everybody, how we become an inclusive system instead of an exclusive system.
Michelle, I was trying to get to my next page for notes. You said kinship. Was it kinship group? What was it?
I think we called it kinship
Teams.
Thank you. I just
like, I had to find my note on the side. I'm like, where is it? But kinship teams, absolutely, so that we're working with everybody.
Yes.
But my group was really focused on humanizing our participants and making sure that they know that the system is working for them and not against them.
Yep. It is human services after all. This is a great segue. We wanted to kind of start wrapping up our presentation by sharing some key takeaways, key strategies, as you can see, to build collaboration. So this is our opportunity to kind of summarize all that we have talked about today with some, actionable strategies that you can walk away with and kind of keep front of mind. So I think we've already started this with the report outs from the breakout groups. But I will invite the presenter team to share other key takeaways or strategies that we want our audience to walk away with.
Erin, are you ready for some feedback in general?
I am, yes.
Okay, because I know a lot of things were covered, but I think the primary principles, I think we heard a lot today. We heard about some principles. We also heard about some skills, but I'll focus just on the principles of collaboration and that, successful collaboration is intentional. We've heard that around clear purpose, clear roles, clear responsibilities. That collaboration requires flexibility. And so it might mean that we need to work in different ways depending on who our partners are or when they're available to meet. Another point that we mentioned in our breakout was, for a collaboration to thrive, all parties must benefit. And sometimes you have to be explicit about what that benefit is. Another takeaway and a principle is that, there's not one size fits all. There's not the magic way to do collaboration, and that collaborations, they're unique and they need to be responsive to their members in that collaboration. So it's not one size fits all. There's great principles, but they're going to look a little bit different and they will change over time. I think the other thing we heard as a principle is just the understanding that, to go far, you got to go slow. And sometimes it takes more time than we think because relationships, are built on trust. And trust is really one of those 5 C's, and it takes time to establish and invest the time needed to build those relationships. And sometimes rushing the process, getting to results, can sometimes lead to partner disengagement. And so we want to make sure that the pacing is we're doing that at the right time. And then the last thing is, as a principle, is again, collaboration is a real journey, and sometimes it's not a straight road, and it takes, like, I'll just go back to the highway example. It takes everybody being on the same highway, being mindful of where they're going, who they're next to, and making space for as many drivers who want to approach as possible. So those were our primary principles as our takeaways. And I know there were a lot of skills that were also highlighted in the discussion today.
I took some notes from even the chat discussion that was happening as we were presenting, and one that stood out to me was kind of this opportunity for people to provide feedback, but also someone said in the chat addressing microaggressions, and I think Michelle, you mentioned that from your breakout too, like the pushback on language that is used, and that everyone has the humility to listen and learn. Others.
I'll just add a little, we might take this for granted, but, to acknowledge the successes along the way.
Yeah.
And to, pause, and, just be very vigilant about being able to see what they are. Somebody had used an example of just a change of affect and language that a judge was using with families after being involved in a collaborative, and how maybe you might have missed that, but to be able to call that out as a success is so important. So
that's great. I did want to switch over. We had some questions for our panel that came in during the Q&A, and we didn't have time because we moved into breakout. So if it's okay, I wanted to, let's see if I can pull those up. There were some good questions. Okay, let me see. Oh, it looks like maybe we've responded some of this, but we'll do it publicly too. Thanks, Bonnie. I didn't see that. But the question was, I think they were all kind of centered around the engagement of lived experience. I think that is a common theme, obviously, that lived experience needs to be at the table, and kind of leading the way sometimes. So how do you prepare your staff to authentically receive and work with lived experience?
Yeah, so I did want to make sure and have some response to these questions. So I went in and gave some response in the Q&A. But what I mentioned in prepping, I think you can kind of look at that first question, how do you prepare staff? And then also the last question of when you hear hard information, how do you handle that? And
Mm.
so my response in there, I mentioned that's where that openness and humility, taking a deep breath, not taking the feedback personally, flexibility and empathy to take those steps to put yourself in those shoes and hearing that perspective. And also connecting it to, I actually think a lot about motivational interviewing, the reflection piece of and evoking the voice of those being like the kind of the center spirit of MI and those skills. So taking some of those concepts like a cultural perspective of being open, humble, listening first, not taking things personally, but then the specific skills of reflecting when I hear something. I try to function and try to I think we try really hard to have that culture of when someone's pushing back, let's ask more questions instead of just defending that initial thought.
You know, Bonnie, if I could just add to this a little bit, I like when you talk about not defending it, but I often think about not giving any reasons and really sitting back and being in a space where we can just learn from our participants and remembering that why something happened is not always the most important thing. So explaining the rules say this, or oh, that happened because this, or that might have been your lens, but what really went happen, and just being in a space where we're like, we're really sorry that happened to you. That was unfortunate. That was your experience, and being able to validate that.
Absolutely. Yeah. Listening first before responding.
Yeah, if we respond at all, because it might just be, I hear you.
True. And then that last question, Erin, I don't know if you wanted to touch on that one too. The last question in the Q&A, how did Oklahoma find lived experience people? So how did we find them to invite them? And so I mentioned several different things that I know that we've done, and I'm sure David and Sarah could add more to this, but one way is inviting those who are connected with organizations and support groups. So like Sarah is our executive director of our Foster Care and Adoption Association. So being able to connect to an already organized group, lots of support groups and different already organized existing collaborations or connections to be able to reach out to and connect and build a relationship there. Another is providing different events like doing focus groups, networking events, virtual meetings, just asking people in a large scale to just come if they're interested in having a conversation. And people come, people show up to that a lot because there's a lot to share, there's a lot to say. So just providing an opportunity, whether it's virtual, in person, whether it's focused or open, those kind of opportunities just to come and join a conversation. And then also, I had mentioned in our breakout group about community-based participatory research, which I'm a researcher, so that's really the heart of what I believe is the research that I do is actually very focused on bringing in the community and participating with them, not studying them. So that kind of concept and being able to do, I've had the opportunity to do some formal research, inviting interviews with lived experience to be able to really get into that depth of understanding what does that mean. So I think all of those ways, there's no one that needs to be done. It's really all, and they're all really, really effective.
Thank you. Well, I see that we are getting very close to the end of our time. So just wanted to put a plug in for our national center, our website, bridgesformentalhealth.org. There's a lot of great information about the National Center on our website. If you have any questions or even just want to have another conversation about technical assistance, please feel free to reach out to Mary. And you can scan that QR code in box 3 and sign up for our email list, which will help you to kind of stay engaged with us. We would love that. And we will share information as it becomes available. And so with that, I will take the opportunity to say thank you to all of you for joining us, for being such an engaged audience, participating in the chat and in the breakouts. And I hope you have a good rest of the Expo Day.
Text on screen reads, "This video was developed for the Child Welfare Virtual Expo by the Capacity Building Center for States and is sponsored by the Children's Bureau. Its content does not necessarily reflect the views and policies of the Children's Bureau.